Hi, and welcome to our new series, which is on fibromyalgia. I thank you for being here, and I thank you for watching our videos. And please let us know if they're helpful, if you would like us to be doing them in a different format. Chat with us. Let us give you the best experience. We want to share our knowledge. We want to share the experiences we've already had, and that friends of ours have had, and give that information to you, where you can then add to it, or you can take it or leave it as you desire, as is right for you. So most people, mainly women, are diagnosed with this debilitating health issue, and several natural ways have been found that will help alleviate the symptoms of fibromyalgia. I want to ask you please to forgive me. I am going to be reading quite a lot, but it's because I'm telling someone else's story. I do not have an experience with fibromyalgia myself, so it is someone else's story, but please take the information, use it, don't use it, depending on what is helpful for you. Thanks. A lot of people have asked, but what is fibromyalgia? And it's a rheumatic disorder, actually, but it's chronic, characterized by chronic muscular pain. Those are the most important words to remember. It's not a joint issue, it's a muscular issue. The most distinctive feature of fibromyalgia is the existence of certain pain points. There are 18 points where the muscles are abnormally tended to the touch. The most common areas of pain are the lower back, the neck, the back of the head, the upper chest, the thighs, and other areas. A lot of areas have been noted, but these ones are, when the doctor pushes on them, they are sore to the touch immediately. So that's why we emphasize them. The pain and stiffness is often stronger in the morning, and it's often accompanied by chronic headaches, strange sensations on the skin, almost like a prickling. Some say it's very itchy, but it's just like the nervy tingling, you know, that happens. It's very uncomfortable, I've been told. And then a lot of IBS, irritable bowel syndrome, and the temporomandibular joint syndrome. That's where the joints are extremely sore. So when you're eating, it's painful to push down, and softer foods are easier to eat. And at the same time, your jaw can lock and then unlock and lock and unlock. So you've got that joint that cracks and creaks and is painful to move. The immune system is typically compromised in this disorder, and therefore patients are more susceptible to bacterial and viral infections. On top of these most common symptoms, other symptoms which have also presented themselves with regularity are things like chronic fatigue, chemical and food allergies, the jaw pain, sensitivity to dairy and wheat products, bright lights, and loud noises. So why are we doing a vlog series about this syndrome? What's made this necessary? Some of you who've been following our previous video on myeloma, you will have heard us sending out the call, is there anyone who has any other health issues that they'd like us to discuss? And we got a number of replies from women between the ages of 23 and in their 70s who have said, please do fibromyalgia. The reason for it is that there's not a lot that is spoken about it, mainly because the doctors don't know what it is, and people start to feel shy about this fact. You know, where is this pain coming from? Why am I always sore? So they keep quiet about it and don't talk about it often. So we have got a story for you. It's Lucy's story. A woman said to us, with pleasure, we can use her story, but she has insisted on anonymity. But the story is given with her permission, and she reads every transcript before I send it out, just to ensure that I've got my information as correct as possible. So, Lucy has used both allopathic and more natural and holistic methods in her fibromyalgia story. In early 2012, Lucy, who's been struggling with a lot of pain in her muscles, had reached her wit's end. She was not sleeping well, was having extreme headaches which mimicked migraines. She was also suffering from bouts of urinary tract infections accompanied by the uncomfortable candida infections. She was having antibiotic after antibiotic, and yet her issues kept coming back. Eventually, after many tests, the doctor told her that she thought she had fibromyalgia. This alone made her feel uncomfortable because at that stage when people spoke about fibromyalgia, they would say, oh, it's an imagined disease. It's women who, they just want to complain about something, but there's no actual cause for it. And so this makes it a very difficult story to talk about because women are given this feeling that they're going crazy, or they're making it up. But she did give Lucy some nerve pain medication, the Lyrica, which did help. It helped a lot. But the thing is, as Lucy said, she couldn't remain on tablets for the rest of her life. She had to find other ways of dealing with this debilitating disease. Oh, these earphones are driving me nuts, but I know that they do help with sound. So, forgive me. So after, she was on the pills for a while, but she knew she needed to try something else. So she did a lot of research, and the first person that she came to was a lady who is known as a holistic counselor. But she herself had endured and overcome the misery of fibromyalgia. Oh my goodness. The challenges on a Monday. Okay. Forgive me again. Okay, this was a holistic counselor who had herself endured and overcome the misery of fibromyalgia. The counselor pointed out that there was a need to look at both the emotional and the physical symptoms that she was experiencing. This helped her in many ways, including giving her the reassurance that she was not alone, she was not imagining her symptoms, and that knowing that many people struggle with this syndrome as such. Other than some really helpful relaxation techniques and exercises, this counselor also suggested some food changes and using massage oils and essential oils for relaxation. A year and a half later, in October 2013, Lucy heard about a nutritional therapist who had helped many people with chronic conditions by checking their bloods for any deficiencies, changing their food intake, and adding supplements to her daily diet. This therapist helped her with the nutritional issues, which will be discussed in more detail at next week's vlog, together with some helpful herbs that she has added. In video 3, we'll be talking about exercise, massage, essential oils, meditation, and other stress-relieving practices that she has found extremely helpful for her. So, in conclusion, it is now 9 years since her diagnosis, and she still has outbreaks, especially if she gets overstressed or anxious or eats a food that her body is intolerant to. That pain can last from 3 to 5 days, just interestingly enough. She has also been diagnosed with osteoarthritis, but as she says, the pain is very different. Fibromyalgia causes muscular nerve pain, whereas osteoarthritis is pain in the joints and the vertebra. Right, so I look forward to chatting with you next week. But before I go, I just want to ask you, please, if you've found this helpful or you like our stories, would you please just press the like button? And we'd also like it if you could possibly subscribe to our YouTube channel and hit the notification bell. This helps bring up our videos when we post new ones, and it also helps get us more noticed so that more people can maybe find the some help and comfort with these stories. So with that, I'd like to say thank you for listening and much love, and see you next week. Bye.